Good day everyone. We are the students from Laguna State Polytechnic University taking up Bachelor of Science in Chemistry. We are here to present to you our conduct research all about cancer cells. I'm Raenaliechelle Maghirang
And I'm Jeramine Sulit.
I'm Maglaya, and
and
we are the
DBQ. All cancers begin in cells, the body's basic unit of life. Our body is made up of many types of cells. These cells are needed to keep our body healthy. Cancer cells are usually formed after a series of mutations, cause them become increasingly abnormal.
This image shows the mutation process where you can see the correct copy and the mutant copy.
These mutations are either inherited or more often caused by carcinogens, cancer-causing substances in our environment.
There is a big chance to develop cancer in older people than younger ones. Factor included to develop cancer is smoking. So, what is smoking? Smoking is a form of recreational drug use. Today, smoking is practiced or used by over a billion people. Because tobacco or cigarette smoke contains more than 7,000 chemicals, 70 of them are known to cause cancer. So, people who smoke any kind of cigarette are at increased risk for smoking-related diseases like lung cancer and can cause leukemia. Just like smoking, drinking alcohol is a factor that can develop cancer because the more you take, the more your body is risk of developing mouth, throat, liver, breast, esophagus cancer. And drinking too much can weaken the immune system and making our body a much easier target for diseases. And the other factors included obesity, poor diet, lack of exercise, prolonged exposure to sunlight.
New mRNA research reveals cancer cells thrive on processed sugar. Nature Medicine has confirmed that processed sugar is one of the primary driving forces behind the growth and spread of cancer tumors. So much so that the future of cancer screening could rely on scanning the body for sugar accumulation.
The new technique called glucose chemical exchange saturation process. The new technique called glucose chemical exchange saturation transfer is based on the fact that tumors consume much more glucose than normal. Healthy tissues in order to sustain their growth explains a recent UCL announcement, noting that tumors appear as bright images on MRI scans of mice.
About 20% of women and 16% of men had a diagnosis of some form of cancer. This included common relatively non-melanoma skin cancers. These numbers are higher than the national adult average of 8.5%. When we say melanoma, it is the
Yung kalahati.
basta sabihin niya may dadagdag pa siyang konti.
Oo, okay yun. Parang
Tanga, nakalimutan ka meaning ng kulang eh.
Game.
Kulang na. About 20% of women and 16% of men had a diagnosis of some form of cancer. This included common relatively non-melanoma skin cancer. When we say melanoma, it is the lack of melanin in our body. These numbers are higher than the national adult average of 8.5%, which may reflect the fact that the 23andMe that shown in the image that customers include individuals enrolled in our sarcoma, MPN, and metastatic breast cancer research communities.
Dr. Kelly states, everybody has cancer. Each day, each one of us has a cancer start and develops in our body. This is a normal ongoing process each one of us experiences. At this point, the normal metabolic defense system takes care of these wayward cells and we go about our daily lives. It is when your normal metabolic defense system or clean-up crew cannot handle this normal body process that you can begin to develop a tumor or cancer mass which can eventually be found by yourself or your physician.
Cancer cells are cells that grow and divide at an unregulated, quickened pace. Cancer cells are malignant when the other cells fail to be recognized and destroyed because of the weakness in the immune system.
Cancer cells are also cells that no longer respond to many of the signals that control cellular growth and death. Cancer cells originate within tissues and as they grow and divide, they diverge ever farther from normal. These cells become increasingly resistant to controls that maintain normal system.